Welcome to Derm Consult on ReachMD. On this episode, we'll hear from Dr. Shannon Trotter, a board-certified dermatologist and a clinical assistant professor at Ohio University and principal investigator for clinical trials at DOCS Dermatology Group in Ohio. She'll be sharing her perspective on how we can improve management of generalized pustular psoriasis, or GPP. Let's hear from her now.
The greatest opportunities to further improve care for patients with GPP, I think at the foundation level is really education and greater awareness on GPP for dermatologists, other healthcare providers, and even patients too that may not realize that they have this condition. To me, that's where it all starts. Conversations like this and getting the awareness out there. And I do think there are some tangible things too. We're just looking at the science of GPP. A lot of my patients, if you look at kind of when they struggle with skin conditions, we want more research, more data on kind of how to treat them. In particular with GPP, they may have plaque psoriasis as well as GPP, two distinct conditions that potentially do require two distinct therapies. With different biologic therapy we have available now, I have treated a patient with both therapies, but we'd like to see more research and data on this. How does this actually work? Could we establish better safety and efficacy? Because again, a lot of patients have both conditions, GPP and plaque psoriasis, and they would require dual therapy that may work, again, very differently mechanistically. And then finally, what I think is really exciting is the advances that are taking place. I love looking at genes, gene expression profiling, genetic testing, and this is definitely a part of GPP, although not always standard of care to have to do it. But with some of the genetic testing that can be available, I think more research will be developed on how do we implement this? How can this test help us in identifying potentially more subtle cases of GPP or potentially even more complex cases? And then even with pediatric patients, I think as we get better at identifying cases, then we can recognize patients for GPP. And with a treatment available now, we can offer them the control that every patient deserves with a chronic dermatologic condition.
That was Dr. Shannon Trotter discussing opportunities to improve generalized pustular psoriasis care. To access this and other episodes in this series, visit Derm Consult on ReachMD.com, where you can be part of the knowledge. Thanks for listening.